Well, welcome everyone. Thank you all so much for joining us here today. It's a real honor for me to get to be sitting here virtually with Julia Puebla Frontier and get a chance to ask her a few questions that I think all of you will find very enlightening and interesting. Just a little bit about Dr. Julia Puebla Frontier. For those of you who may not already know her, she has worked in this space for over 30 years, and her goal is really to improve health outcomes and health services for migrant, minority, and other culturally diverse populations throughout her career. She's also worked with the World Health Organization and the International Organization for Migration as a facilitator for two global consultations on migrant health. She's also been the director of Diversity RX, which is a non-governmental organization focused on good policy practices and research on healthcare for diverse populations. She's also led the U.S. Standards for Culturally and Linguistically Appropriate Services, or also known as CLAS, CALS, in healthcare. And then prior to her work with the Diversity RX, she was a staff member of the U.S. House of Representatives Subcommittee on Health and the Environment. And the list goes on and on. And she's just someone who has been a leader in our space, and particularly a leader also with NCIHC, and one of the pioneers for getting to do what we now get to enjoy here 25 years later with the NCIHC. So, Julia, thank you so much for being with us today.
Thanks very much. It's really nice to be here and talk.
And we've got a few questions for you. We're going to go ahead and start off with the first one is, could you speak about three items that propelled you on the path toward linguistic inequities?
Okay, yeah, absolutely. So first of all, I come from a bilingual, bicultural background. My mom was born in Mexico, and I learned Spanish at home. And then, round about the time that I went to college, and then afterwards, not only had I studied Spanish a little bit and done some research in Mexico, I started doing some volunteer work for a community clinic in Washington, D.C., where I was an interpreter for Spanish speaking prenatal patients. And so that sort of got me into that first realm of, what happens when there are language barriers to healthcare. And that was at the same time I was working on the Hill for the Subcommittee on Health and Environment and sort of very interested in big national health policy issues. And sort of simultaneously with that free clinic work, I started working on the first Disadvantaged Minority Health Improvement Act. And as part of that process, we were approached through through two representatives' offices, Representative Mineta and some other offices, to talk about language access issues in community health clinics. And so that was really the first time that I'd heard from frontline providers about their challenges in delivering healthcare services to a lot of different diverse populations with different language needs, and how essentially there was no funding for that in that. And so that, of course, resonated with some of the practical experience that I was having, and we decided to look into that on a policy level to see what HHS was doing on this issue. And it turned out that there was still a lot of work to be done at the federal level, including recognition for these needs and community health center funding, but also looking at how these issues might be dealt with across other federal programs. And that brought us into touch with the people who are working on Title VI of the Civil Rights Act and the provisions that were in there, but only sort of haphazardly enforced, depending on the part of the country. And so the more investigating we did to find out the dimensions of the problem, the more I came in contact with people around the country who were doing critical frontline work in this area. And so folks in Massachusetts with the MMIA, what used to be the MMIA, and folks in California and in Washington State and in Minnesota. And slowly, over time, I got to meet some of the leaders, which are also national council leaders, people who were working in a variety of different settings. And we started to talk about, well, what can the federal government do to make your work easier and to make these issues more prominent? And so I guess that segued from
Hmm.
sort of working in the community space, from the personal space to the community space to the national sort of policy space, where we did come up with some provisions and get that into the legislation. But at the same time, that was sort of an opportunity for me to really make connections with people who perhaps hadn't done a lot of work with national policymakers and some of the national health stakeholder groups, and to begin conversations about how do we raise visibility of this issue, and how do we do it outside this policy sphere? So not just in government, but with the hospital associations and the medical associations and all of the other big national health players. And so that was the beginning of a multi-decade odyssey
Wow.
to really get these issues on the map. As I said, with a lot of
Hmm.
other very important people, both on the Hill, but also,
Right.
I think, more importantly, off the Hill.
Yeah, definitely takes a village, doesn't it?
Yeah.
And another question for you. So what was your role in the development of NCIHC?
Yeah, so that I think started by my being invited into some of these regional conversations, like those in Massachusetts around the development of the Code of Practice and the Code of Ethics, and the development of a curriculum for medical interpreters. So, being part of those conversations where these issues were starting to be put into play, and then having those conversations in other places, like other parts of the country, and slowly, as sort of we all came together through various meetings that were hosted by different people in different places, I think the conversation turned towards the idea of how do we have a national presence on this issue? There needs to be a single unified body that is really promoting this agenda, a go-to point for whoever it is that wants to ask questions or to say, what do we need to be doing around language access issues? And so over discussions with many different players over the years, and for some of my encouragement around the advocacy agenda and the policy agenda, the sort of notion of the National Council began to come together. And so lots and lots of meetings with lots of
Yeah.
different people as part of that. And then we sort of put together a board, a volunteer freelance sort of board. And Cindy Road and I were the first two co-chairs of that board when
Mm,
the organization first got started.
excellent. And as far as just your looking back at your journey for language access, what would you say that the language access has done for you, and where do you see your journey with language access going?
Yeah, well, it's been really exciting to be part of something that sort of touches on my own heritage, but also brings me into contact with other people around the world actually who are grappling with these same issues. So while I was working with the National Council and and on the Hill, and then after the Hill, I was involved in this effort to develop the class standards. So develop some of the first policy
Mm,
research around that, and then help lead the national consultation processes around that. And then right after that came out in 2000, I moved from the States to Europe. And over the next 10 years, got involved with conversations in the European Union around cultural competence and language access. And so my sort of part was to bring all of the experience that we had developed over the years into the European scene, and to help those different countries that were at different stages of development begin to develop their own policies and their own advocacy strategies. And then from that, um, also became involved with WHO and IOM, which were beginning to see migrant health as an important issue, kind of reluctantly at first in the beginning, but more so as the years went by. And that was sort of my role in helping co-facilitate those conversations. And then after that, I went to Japan, and then was actually through some people connected to MMIA, or the International Medical Interpreter Association, able to connect with interpreter advocates in Japan and look at their language access issues there. So you could say that it's been kind of a thread that I've taken with me in different parts of the world while continuing my work with Diversity RX for over 30 years, and that has just been an amazing opportunity to get different perspectives and and to see how it works in different political and cultural contexts, and to meet really cool people in many different countries. So that's been an interesting part of my journey.
Wow, what a journey. That's just truly remarkable. I mean, it's going from Mexico to DC to, you said, to England to Japan, then England to Japan. Um, that's incredible. Wow, and you've done so much, and continue to just really touch lives. And we just thank you for all of your hard work in our industry that a lot of times people outside of our industry don't see. We see it, and the impact that you've had has touched, I'm at this point, millions of individuals, because of your hard work. And our industry is younger as a professional, and it takes people like yourself to be able to come in as the pioneers and really pave the way for the future, and so we can continue to carry that forward. So we just thank you for what you've done and what you continue to do in the language access space, and particularly what you've done at NCIHC, and helped us get to the 25-year anniversary mark. So,
Well,
yep,
it's been a real privilege to learn from people who are
yeah,
so expert in this. I'm not a professional medical interpreter, but bring a different set of skills. But it's really all of all of the interpreters, all of the frontline people like yourself who are really doing the super important work. And so I'm glad to just have been able to go along on that journey and help guide as I can.
yes. Well, thank you so much for taking the time as well to join us here this morning.
Yeah, thanks a lot.
Thank you.